I'm Andy Kinnear. I'm the chair of the BCS Health Executive.
Okay, well, thanks for your time. So, why are we here today? If you want to start with that.
Yeah, so I think this is about learning from the best of the best. The guys that are going to be speaking today have written the book on health informatics. They've sort of defined the way we should deliver these services. So, to be in a room and to listen to their experience and to listen to their knowledge, I think is a great opportunity to take some of that learning and put it into practice.
And of course, we've got HC in a day or two. So, what are the key things you're hoping to get from being at HC? I mean, what's the main theme this year? Do you know?
Yeah, so we're looking to focus in on person-centred care, and I'm really keen that we begin to sort of have a debate about how we move the digital health world into the patient space and into that patient sphere. The development of personal health records over the next 2 to 3, 4, 5 years is going to be the biggest step change we'll see in digital. So the beginning of that debate is starts this week.
So you mentioned person-centric care there. What are your thoughts on what are the biggest challenges facing us at the moment, trying to generate more person-centric care?
Yeah, so lots of the effort that goes on at the moment inside the health and care system in the digital world has been about how we manage the professional records, how we manage the records that our doctors, our nurses, our care professionals use day in and day out. For me, the big challenge coming forward is how we move that debate, that conversation and that delivery into a space where the patient is involved and where the public are involved. So they actually take some of the responsibility for managing their record and also take the advantage that comes with it. Many other industries we've seen huge channel shift in the work and the responsibility that goes on in that industry from the organisations providing the service to the public, and by and large the public appreciate and benefit from being able to take control and manage their use of those services themselves. And if we can follow that model and deliver a service like that in health and in our care system, then I think we've got a real fighting chance of making a viable service for the long term.
And what do you think BCS could be doing to help things?
Yeah, so I think the role of BCS primarily for me is around the professionalisation of the folks that then deliver this service. I think in many ways what we've delivered digitally in health and care has happened because of people's honest endeavours, but not always because we've applied the most professional approach to that delivery. The role for BCS for me is to make the delivery of those services as we go forward as professional as possible. I guess one of my personal reflections is that I've had a really tough 25-year journey from a position as a junior analyst all the way up to a CIO role. It's felt like a real hard slog, and almost feel like I've succeeded despite the system. I think we've got a duty to ensure that the CIOs of the future and the clinical CIOs and the chief nursing information officers don't have such a difficult journey to get to their roles and are actually supported along the way. The digital services we need to deliver for health and care in the future are too important to be left to chance. So we've got to make sure that those folks get there and have got the skills to deliver when they get there.
So where are we in general with health informatics? Is it a good place to be in the UK at the moment?
Yeah, I think it is actually. I think we're in the midst of a revolution. I think history will show these years, 2015 through to 2018, as really significant in the history of digital health. I think we're kind of out of the shadow of some of the previous models of delivery. There's a real feel good. There's almost like a social movement going on at the moment. The energy, the morale, the networking is really high, and I think there's a real sense that we're on the verge of delivering some amazing stuff.
And do you think the public are more on board now? Because obviously, go back 6 or 7 years, people were very worried about their personal data being out there, and there was bit of a backlash against the personal patient data be out there. I mean, security seems to have been increased, etc. Do you think the patients are now more along for the ride?
I think they are. I think there's a few reasons for that. I think generally, if you spoke to most members of the public about the NHS, for example, they're of a view that it's one system, one service, one entity that they deal with day in and day out. And actually, I've been heavily involved in shared record programs where we've shared information between different health and social care organisations. And when you speak to the public about it, most of them think it's happening already. This is not a challenging subject for them. I also think if you look at the way digital and technology is used in everyday life by vast majority of the population, then their expectation that they can do things digitally is far higher than it was 10 years ago. We've come on an amazing journey as a population, really, in that regard. I think where they've got concerns, in my experience, is about the use of their data and the safe and secure storage of that data. But I think, again, we've got a proven track record of consulting with people about how we might or might not use that data, and by and large we're using it for the greater good. We're using it in a way that will support the development of services going forward, and I think most members of the public would support that.
And for people who are interested in health informatics and maybe a career in it, do you have any advice?
I'd say get on board. I said this is the party to be at. It's really, really good fun. I think that the what I enjoy is the cerebral challenge that we have day in, day out. We're tackling some really interesting problems, things that nobody's done in the past, but we're also working in a space where it makes a real difference. What we do really does matter. There's a direct line of sight between the digital the digital service that we deliver, the care professional, clinician, doctor, nurse, and ultimately the patient and the public that we serve. And actually it's a really rewarding place to be when you've got that kind of mental challenge day in, day out, but what you're doing is making a real difference to society.
And you mentioned you're currently a CIO. I mean, what's good qualities for a CIO, do you think?
So, I mean, you've got to have some of the basics in place. You've got to be, technically competent. You've got to be, a decent manager. You've got to be able to manage a budget. You've got to be able to do the fundamentals of a senior management role. But I think the key skills are really you've got to be able to interpret the digital world for the rest of the organisation or for the rest of the health and care system. So you're working with colleagues day in, day out who don't spend their time in our digital environment and in our digital world, and so your job is to interpret that opportunity and play that into those folks so that they can understand why investing time and money in digital will make a difference for them. I also think one of the key skills for me is sort of getting out of your office, getting up from your desk, being at events like this, being part of this national dialogue that we're seeing now, be part of the CIO network, be one of those voices that's in the space that's actually setting some of that agenda rather than just reacting to it.
And do you have any sort of request or message to UK government about the state of play with health informatics at the moment? Do you have a wish list?
Yeah, I mean, I think some more money would be nice. I think there's the digital stuff doesn't come without an investment, but I think to their great credit that we are seeing some investment in digital health and care services where many other elements of the public sector are suffering from austerity. I think I would go back though to the professionalisation question. The reality of delivering the digital programs is that we're not going to be successful unless we've got a highly skilled, highly professional workforce to do that. And so investing in the development of that workforce is absolutely critical.